Hello, my name is Drake Short. I'm a third-year medical student at Oklahoma State University College of Osteopathic Medicine. I'm presenting an assessment of emotional intelligence in medical, physician assistant, and athletic training students. Previous research shows that a very key part of patient-provider interactions is emotional intelligence. Patients report higher satisfaction and happiness in their clinical encounters with physicians who show a high level of awareness of their own emotions and the ability to manage them competently, which is another way to define emotional intelligence. However, previous research has shown a lack of high levels of EI, specifically amongst graduate athletic training students. There has yet to be a comparison between different graduate level healthcare professional students and the programs they're in based on emotional intelligence. And so our study aimed to use a valid EI scale to compare the emotional intelligence of medical students, physician assistant students, and athletic training students. The participants in our study were first and second year medical, physician assistant, and athletic training students. They were provided a link to a survey that has been used in various similar research studies with similar methodology and is known to be valid and reliable. This is a questionnaire with 33 items where respondents choose their answer based on a 5-point scale, and these points are then cumulatively added up to give an overall EI score. The results of our study are shown in Table 1 in the middle. Significantly, we found that there were no significant differences in EI scores between medical, PA, and athletic training students, both overall and based on their year in school. Additionally, the overall mean EI score for all subjects was consistent with previous research. That mean was 127.33, and that total score was consistent with the previous study mentioned prior amongst graduate athletic training students that showed a low level of emotional intelligence overall. In addition, males in this study demonstrated a higher overall EI score than females, seen as males with a mean of 135.63, females with a mean score of 125.19. This is likely due to an increased average age of the male subset in our study. We know from previous research that increased age is associated with higher emotional intelligence. Additionally, Hispanic/Latino and American Indian/Alaska Native students had higher cumulative EI scores than their peers, which was well above the mean. Also worth noting, Asian respondents had EI scores well below the mean, which were lower than their peers. These findings suggest that upbringing, culture, lived experiences, in part due to race and ethnicity, are contributory to overall EI. We know that emotional intelligence may mean different things to different people, and because of this, we believe that medical training programs should include culturally competent EI programs. Medical professionals are routinely engaging in demanding situations where they're asked to use empathy and nuance to interact with diverse populations. We know that previous research shows that emotional intelligence leads to greater patient satisfaction and better outcomes. And so we believe that the admissions process and the curriculum of medical and allied health graduate programs should implement emotional intelligence material. And this should happen in a culturally competent manner that considers racial and ethnic variables. And that if this were made reality, healthcare students would be more adept at meeting the challenges that their patients present in a unique variety of settings. Thank you.